Glaucoma is a condition of the optic nerve, the nerve at the back of your eye that sends your vision to your brain. Traditionally, we always thought of glaucoma as a high pressure, the pressure in the eye being too high and that damaging the optic nerve and causing you to lose your sight. We've recently learned that although pressure plays a role, it doesn't necessarily have to be high, i.e. out of the abnormal range, to cause the damage. It's just too high for your eye and we need to lower the pressure. And we know that lowering the pressure lowers the risk of you developing glaucoma. So it's very important that you get your pressure checked and you make sure your eye nerve stays healthy. Glaucoma is caused by many factors. Some of them are unknown. The biggest factor for glaucoma is the pressure in the eye, the intraocular pressure. That is the one single factor that we can try to treat and control, and that's how we manage glaucoma, by keeping the pressure down. There is a genetic component to glaucoma, so if you have a family history of glaucoma, you're much more likely to develop the disease, and certain people with certain conditions within the eye or generally, such as diabetics or short-sighted people, are more likely to get glaucoma. We diagnose glaucoma traditionally with three important items that we need to look at. The first being the intraocular pressure. We're going to look at the pressure within the eye and make sure that's normal. If it's high, then that increases your risk of developing glaucoma. The second thing we look at is the visual field, looking at the peripheral visual field of vision, and traditionally that test is done on each individual eye separately, and it maps out your field of vision and tells us if there's anything going on that needs treatment. Normally, glaucoma affects your peripheral vision before it affects your central vision, so we need to test the peripheral vision. And then, most importantly, we need to look at the optic nerve at the back of your eye in detail. The optic nerve gets damaged from the pressure, makes it thinner, and you lose nerve axon fibers. We need to detect that and treat it and stop it from getting any worse. We have scanners now that can scan your nerve and look at the invisible layers and tell us exactly what's going on with the optic nerve, and before we can even see a thing, the scanner will pick it up and tell us your risks, and it will actually look at your nerve and compare it to a healthy individual of the same age. We also have measurements of the walls of the eye to make sure that your wall isn't thin, which is an independent risk factor for glaucoma, and we have little tools that we use nowadays to look at within the eye, looking at the drainage system, so we can accurately assess that and look and see whether there is any blockage going on, for example. Broadly speaking, there are three different categories of treatment for glaucoma. One is the eye drops. Now, the eye drops work very well, but they do rely on the patient having to put them in every day. They can give you local and systemic side effects, so we do watch out for those, and they can also stop working from time to time. And occasionally we need to use combination eye drops to get the pressure down, because all of these medications work in slightly different ways, either by increasing our drainage or decreasing the amount of fluid the eye makes. The second is lasers. The lasers have been around for quite a while, but nowadays the newer generation of lasers are very effective and very safe and painless and quick. So some of my patients will be very suitable for a laser treatment to lower the pressure. Some of these lasers work by removing the cells that make the fluid in the eye, and then some of these lasers work by increasing the drainage system, the space within the eye, to allow the fluid to drain better and keep your pressure down. And these are nowadays outpatient procedures with no downtime for the patient. And then thirdly is surgery. Surgery is very effective, but it is invasive. The gold standard trabeculectomy operation works very well and is still one of the go-to procedures when we really need to get the pressure down and save someone's sight. There are newer techniques which work just as well nowadays, which are less invasive and quicker and obviously kinder to the eye as well. For example, I can do a trabeculectomy in about 20-30 minutes, but I can do the same thing with the newer microtube Zen procedures, which do exactly the same, in under 5 minutes with no major cuts or stitches to the eye. So there are lots and lots of new surgical techniques on the market now, and we're evaluating them all and looking at what is suitable for each individual person.